Hi, I'm Dr. Blake Wu. I'm the owner operator of the Sports Pod. I am a sports medicine chiropractor that has been practicing for over 15 years, and I specialize in athlete injuries.
Hi, my name is Coach Eric Rosenstock, and I have been a strength conditioning coach for over 15 years. My focus has been in CrossFit and Olympic weightlifting and getting people moving better.
And this is SPCAST with Dr. Blake Wu and Eric Rosenstock, Humans Fixing Humans.
Man, so this morning I was making coffee and I was doing, one of these.
Yeah.
I want to crack my neck. And then it got me thinking if like Steven Seagal came up behind me and just gave me that,
Yeah.
it'd kill me.
Oh man, I get answered this, or I get asked this question so many times. And one, does your neck feel better? Yeah, see.
So sometimes it really hurts and I can tell I'm like so close to getting it.
Yeah. Look, no, you're not going to die. This is like a common question that I get at the clinic, which is like, which I don't take offense to it. It's people should ask the question, but no, you're not going to die from a neck adjustment. It's and let me preface this by saying, and you know this,
Mhm.
I'm not your regular chiropractor. Like I do
No.
not, I don't go to adjustment first. And honestly, for me, an adjustment is like an ancillary tool. It's something to get to the patient um, out of a situation where they're feeling an immense amount of pain and I just need to get the range of motion. There are other chiropractors out there that like base their entire fucking identities around adjustments, right? Like just again to contextualize for people, there are people out there that just there are chiropractors out there that just believe that the chiropractic adjustment is literally everything. There are people that truly believe that that is like aligning your entire immune system, your gut system, all of it, because it's really tied into the nervous system. And I am not one of those people.
Yeah. And for those of you this is like your first time listening to the podcast, we actually did a whole episode breaking down the different types of chiropractors. So if you want to look into learning more about kind of a skeletal first approach versus muscle system.
And look,
can-
again, which we've discussed in that previous episode, to each their own. I believe, as being on the other side of it or on the other part of the spectrum, like we need as many diverse doctors out there so that more people can choose what they want to choose. Like I'm at heart like a libertarian. Like do whatever the fuck you want to do, as long as it's silly.
more tools in your tool belt, the more often you're able to fix the issue.
Right. So like for me, because we're sports, of course I'm gonna need to have a ton of tools. But for the people at the, I was about to say the company, I'm not gonna say the company, but we don't want to get sued on our
Let's not do
what
that.
is like our 10th, 18th episode.
Yeah.
That being said, I'm not one of those doctors that just adjust like crazy. And there are specifically neck. There
Yeah.
are these doctors that are called like hole-in-one doctors, which all they believe is adjusting your atlas, which is the adjustment at your skull and where your skull articulates with the first cervical spine. And they believe that adjusting that literally aligns your
Top-down approach,
top
basically.
down. Yeah, so they always do it. Doesn't matter if you have a toe pain, that's what they're going to do.
Which is ironic because in strength conditioning and in like biomechanics, it's kind of the opposite. Like in looking bottom up, we're like, well, how do you clutch the ground? And you're like, what you interact with the most when moving is the floor.
Is the floor. So yeah, there are different types of doctors. And no, let me repeat this. Steven Seagal is not really killing people. It's so crazy to me that people like can't. I mean, I guess it's not that crazy because I think people think ER is real hospital stuff. which is not. Any doctor will tell you like that's not how an emergency room is run, and those are not necessarily the procedures. And somebody coming behind you, like
He's doing rapid.
doing a rapid.
There's not enough
vector.
force. It would have to be like really far down to the side, basically.
Yeah, I'm not saying that you can't die from
A neck
complete torsioning your neck, but it would have to be from a legit like crane hitting your head. And
It's a pretty strong
yeah, it's gonna be the force that is needed to like actually,
car accidents.
yeah, car accidents, falls, roofs, dive.
Serious blunt force trauma.
Yeah, blunt force trauma. What I am producing with my hands, it's never going to happen.
Yeah.
It's just never like the mechanical engineering structural way of actually breaking somebody's neck is you need a ton of force.
Yeah. So I think, before we go further down this topic, because it does interest me, can you explain more about what a neck adjustment is and like how you are, because I've watched you do, a good amount of neck adjustments, and it's a very precise position. Like you're working with the athlete, you're telling them like, hey, relax here. You're putting them in a certain position.
So the first thing in literature, essentially any chiropractor that tells you that they're specifically trying to adjust a certain vertebra
Yeah, that's
is lying to you.
Yeah. I never understood that. Like when my first interactions with like neck adjustments, I was like, I was like, there's no way they could isolate this.
So we can isolate certain areas and regions, of course, right?
Yeah.
Like I could be like, I'm just trying to get to the top half of your neck or the bottom half of your neck. But to be like, I'm getting exactly at C6, C7 is ridiculous. No doctor is actually adjusting that. And what you're seeing when I'm doing it at the clinic is I'm just putting the neck at end range of motion. So your cervical spine, what it does is it flexes, extends, and rotates and laterally and laterally flexes. So what I'll do is to get the joint to be at the end range of motion so that I can just thrust at a very small thrust and just make the joint express its full range of motion. That's what I'm doing is when I'm getting them into that position.
Yeah.
Now, what's actually happening to the joints? So I think one, it's really important to distinguish what I'm doing. Why am I doing a neck adjustment or why am I doing any type of adjustment in general? The reason why I'm doing it is oftentimes athletes are coming in with less than optimal range of motion that I need them to be.
Yeah, they're doing the RoboCop.
Right.
Yeah. You ask them a question, their whole body.
Yeah, whole body turns. And we'll use a great example because this often happens to just a normal regular Joe, which is like a crick in their neck. They wake up.
Funny.
Yeah, and they're just like, I can't move my neck.
Right.
Okay. So that is a great example of when look, it's like a chicken or egg. I don't really know whether it's a muscular thing that is creating the crick in your neck or a joint thing that's creating the crick of the neck. But the most obvious thing is probably both. Like we are gonna, so you'll see me do, oftentimes you'd never see me, you can attest to this, you never see me not do the muscle work first.
Yeah.
Because it's like I'm working superficial in.
Yep.
So I have to work the muscle to get it to move a little bit. And then if I work the muscle for like 20 minutes and it's still like not moving the way that I need it to, then I'll adjust it. And oftentimes that will give me the range of motion. Now, why does the adjustment do that? Well, the adjustment does that because there are little nerves in your joint, right? And those nerves are telling your brain like where you are in space.
Yeah.
And those need to be resetted. So when we adjust that joint, when we adjust your neck, I'm resetting all of those joints to going back to, oh, like that's my range of motion.
Yeah.
And that sometimes alleviates some of the pain. So you have pain-free range of motion, or sometimes that just allows me to have the range of motion. So now we can get
Right.
into it, but it's still a little bit painful.
Yeah.
But that's okay. Like we're going to work into that because that could be a muscular
Yeah.
thing. The other thing that happens, which is like what people often ask, like, what was that pop? When you have, and it doesn't matter, I'm not looking for the pop. I'm looking for whether or not I got the range of motion back. The popping is essentially little bubbles of CO2 in your joint. Everybody has it. Your joint has these little bubbles. Once I come through to the full range of motion, you're releasing some of those CO2 bubbles, and that's what you're that's what you're hearing. But again, the whole thing is of the popping, it doesn't matter. Like what
Yeah.
you also hear me say in the clinic, like popping and snapping don't matter in your joints as long as it's not followed up by like a burning pain or a sharp pain or a dull achy pain.
Yeah. I think it would help people understand, or not necessarily understand, but be a little bit less cautious if they knew like the actual like risks behind it, because they're so like infinitesimally small. I mean, like,
Yeah, I mean, look, and this is literature that comes from the Spine Journal, and anybody can look this up. It's again widely studied.
yeah,
And this is again, it's like perception versus fact.
yeah,
The fact is that you have a 1 in a million chance of
yeah,
having a vertebral. So when people the most associated myth of a neck adjustment is like you're gonna get paralyzed, which there have been no instances of
yeah.
that. And two, um, I don't know. Let me go back. I don't know if there is no instance of that, but I've never heard of an instance
Yeah,
of that. And I read a lot, and I also
yeah,
go to a lot of conferences, and I've never heard of a
yeah. I
situation
think it was. I think I saw. I think like the NIH posted something about this where it was. I'm almost positive it was like 1 in 10 million adjustments has a like an adverse reaction,
yes.
and that's just like a adverse
Adverse
reactions.
reaction.
Yeah.
That's so
So
in general.
yeah,
But for like for a more conservative, like even then, like you're to have, so what's happening is like when people think about like, am I gonna die from a neck adjustment? It's really what we call a vertebral artery dissection, meaning like you have two vertebral arteries that come up from your neck or from your brain into your neck. And that's what's supplying all the blood into your
right.
brain.
So you would have to sever it,
You
or
have to have a
a
dissection.
dissection of it.
So a dissection is not severing it. What you're doing is you can either create a longitudinal, latitudinal tear along that vertebral artery, which then blood is coming out, right? So it's like a cut. And so that is that's what we're learned. Like that's what you learn in school is like vertebral. And I promise you, in school, they are teaching you this like
Yeah.
from day one, and they're fucking hammering it in your head
Yeah.
over and over and over and over again. And the times, I mean, again, staying on topic, the odds are literally 1 in a million. Like
Yeah.
you have a better chance of stroking out from a Tylenol than you do from having a neck adjustment.
Right.
Just like, and again, I'm a big proponent of like, is your body do whatever you want.
Right.
to do
Right.
with
Right.
it.
Risk
If
analysis.
you don't want me to do the neck adjustment, you're tying one hand behind my back. You're like asking me not to use one tool. I have many other tools that can get it, but don't also expect that this is gonna get like, my whole goal is like, I want to get you better as quickly as possible.
Yeah. Using everything.
We use everything I can in my arsenal. So when you start, what my analogy is like, you wouldn't ask a mechanic to fix your car and be like, I don't want you to use a screwdriver or a wrench.
Good luck.
Or you wouldn't ask a surgeon to be like, I want you to do surgery on me, but don't fucking use a scalpel on me. Like, my whole thing is like, if you're gonna come to me, let me do like, you're asking a professional to help you get to A to B, right?
Yeah.
Why would you tell that professional, I don't want you to do X, Y, and Z?
Right.
And it's just me. I mean, my whole thing is like, I'm paying my professionals to get, I don't tell my accountant, don't use QuickBooks or don't use whatever tools to, to make my finances look good. I just like do my
Do your job. Yeah.
do your job.
So we kind of went into the stats, but obviously, statistics are affected by a number of, factors.
Yeah.
Namely, like, who are these doctors where this has happened? Because it's super, super, super rare.
Super rare.
But I think you can also increase or reduce the risk further
Yeah.
by making sure you go to like a licensed.
Yeah. I think this is like a great example of kind of the 80-20 rule.
Mm-hmm.
Or, when you look at statistics and you look at a graph, it's a quite flat graph. And then we call that the thin tail. And then there's a fucking
Hockey stick or whatever.
and then there's that, we call that the fat tail, right?
Mhm.
And oftentimes the fat tail is usually 20% of the or 20% of whatever the pie is,
Yeah.
and then 80%. So I would say 80% of the doctors out there are quite good. And this is like any profession. 80% of any profession is quite good. And then you have the 12% or 20% that are kind of bad actors, and they are accounting for most of your issues
Yeah.
in your profession.
There's like that common joke. It's like, what do you call a C student in medical school?
A doctor. Right. We're not all made equally.
Right.
And yes, there are people in your class where you're just like looking at them and
You're like, oh my God, they're going to be treating people.
yeah, you're like, oh, God, I saw that guy struggle real hard. Yeah, so look, and a few bad apples don't ruin a bushel, but unfortunately,
That's what you hear about.
that's what they hear about. And which again, I want to respect my profession and my other colleagues out there, but there are some doctors out there, and you can easily go. The first sign that there might not be a great doctor is that you're paying $20 to go see that doctor. Okay, like, dude, you get what you pay for. Look, one, these are the red signs that like you're more likely to 100% have a neck adjustment and probably have some adverse reaction to it. One, if the price doesn't necessarily match, right? So if you're going to a fucking $10 new athlete exam, or $20, like you should, or free, like
Yeah.
you
Well, they don't even do that.
yeah. Okay. It's like you perk up on that. Okay. So that's definitely a red flag.
Yeah.
Second red flag. The second red flag is if they say hello to you, ask your name, and then they immediately start touching you. So they don't even ask you any questions about what's going on.
History is
Their history. So if they do zero history, you're fucked. Like you're right to walk out. Because how the fuck do they know what's going on if they don't even do a history? Third, they don't even touch the area that you are in pain.
Yeah.
Like if you're like, I have neck pain, and they don't even touch that area, they're just like, oh, I know exactly what this is. We're just gonna do it.
Not possible.
Not possible. Four, they again, no history. They don't touch you. They immediately go into X-rays for some reason. Like there's no primary reason why you're doing an X-ray outside of they're like, I need to see your alignments, or they might hook up a machine to you and they're like they're telling you where you're misaligned. That is like a fucking bunch of hoodooky. Like it's just you walk out of there. The doctor only spends like 5 minutes not even 2 minutes with you, and just immediate. So no history, no touching. They fucking X-rayed you for some reason, and then they're just adjusting you, and then they're like, okay, you're good. You got out. Like these are fucking red flag situations. Like I think it's really bears to talk about like why there's an association with like strokes and neck adjustments. Like most of the time, like 98% of the time, the patient is already coming in with stroke-like symptoms.
Right.
And knock on wood, this could honestly happen to anybody, and I'm grateful that hasn't happened to me. If you're taking a good history, even if you're taking a good history and you're taking a good physical, you could still miss it
Right.
because it can be disguised as other things.
Yeah.
And we're again, like, we're human, so like no one's perfect. But most of the time, somebody is actually coming in with a stroke already, and
Right.
and then they adjust them, and that they have an adverse
It's the straw that
reaction.
broke the camel's back.
Right. But my analogy to this is, look, there are millions of people that go to medical doctors with like serious signs and symptoms, right? Like they might have a car accident and they might have a hemorrhage in their brain, but that doctor is missing it. And they're just like, well, this is just a concussion. So just put them in a dark room and here, take some aspirin and come back tomorrow or to come back in 2 days.
And they go and die.
And they go and die. But you don't see a ton of fucking headline news like, hey, medical doctor kills this patient.
Because they know that.
Like, because they gave them an aspirin. No, you never hear that. But whenever a doctor of chiropractic that has happened to that, it's a fucking big news, right? So,
Or like, in my previous profession, owning a gym, you'd hear these horror stories of, you need to have an AED because
heart
attacks. The exercise is not usually what causes the heart attack. Like, and more often than not, like this happened at a CrossFit gym in Dallas, and the guy was just like hopped on the rower for the warm up and just
stroked out.
he had
a heart attack
on the rower. Like, just start like.
Right. So this is a great example of like primary cause of death and secondary cause of death.
Right.
The primary cause of death in that situation was that he had a bad heart and he was already having.
He was like on the cusp of
The secondary part of it was just doing exercise induced that increased his heart rate that just pushed him over the edge.
Right.
This is the example of the stroke is like the primary thing was this person was having a stroke already. The stroke is what killed that person.
Right.
The secondary is like, unfortunately, the doctor didn't catch it, which again can happen to anybody. I think like there are like medical profession, they get a free pass for some reason. And then even though this only happens like 1 in a million patients,
right,
it's solely brightly. I don't know what the stat is, like how many times you go to a medical doctor and they miss something and a patient dies, but I promise you,
it's more than adjustments.
The odds are probably like in favor of the chiropractor.
Right.
Like you're more safe to go to the chiropractor.
And it all just goes back to like being very like aware of the person's, like, not just their history, but just looking at how they're functioning.
Yeah.
Because there were times when people would come in and they, be their first like on-ramp for like a CrossFit, membership. We would take them through this, a 4-class on-ramp. And there were times where I could see they were like really shaky, and I wouldn't train them. I would be like, hey, did you eat this morning? I would immediately be like, this is weird. Like, I need to stop. Like, and, I was like, hey, can you get like a blood test before we train? Because you're a little shaky. You look a little pale. And
this is not a normal reaction to an on-ramp at a CrossFit.
And, I'd always like comfort them. I'd be like, hey, this is stressful. You're doing something completely new. Maybe you've never worked out before, but like the golden rule is like do no harm, right?
Yeah.
So if I can tell that a person just doesn't look like they're going to handle exercise right, I'm not going to put them through a workout. And more often than not, it's like they will tell me, oh, I switched to, I went vegan 2 weeks ago, and they're like severely anemic and they just look like they're about to pass out. There's like the cold sweat beads on their forehead,
completely white in the face.
And it's like January and across the gym, like they should not be sweating, And so like it just, you have to do a good job of like paying attention to what their body language is showing you.
One is like, I'm not absolving my profession. Look, there are some bad actors out there. I'm just saying the 20% does not represent the 80%. And there are people that are very detailed oriented and they're going to, cross their T's and check their I's, dot their I's, check their I's. And might as well be Ricky here. 2 turnips. That's titled
Their cheese
it.
and
Titled two turnips to heat up the turnips.
heat up the turnips.
Look, I'm not absolving my colleagues.
Right.
I mean, again, I feel bad. I honestly, it's a terrible situation for both people. You can be empathetic towards both parties, like the
Mhm.
party of, I truly believe that most doctors their intention is to help you,
Right.
not to hurt you. And when that happens, dude, like that person's life, the doctor's life is forever changed.
Correct.
Like that
Right.
person probably will never work as a doctor ever again.
I can't tell you how many times like people will come into the clinic and they'll be experiencing something and we'll ask them like, well, did this person do this?
Yeah.
And sometimes what they tell us that either it's like an ortho or a doctor or a physical therapist, like we wince.
Yeah.
You'll see us, we go like, ooh, why do they have you do that?
Yeah.
So we see it a lot. I feel like where
Yeah. I mean, look, we're aggressive of what we do at the
Mhm.
clinic, but we're also conservative in the sense of like, there's a reason for everything that we're doing and why we're doing it. And we're just making sure that we are being thorough about what is going on. We always
Yeah.
explain what's going on and we explain why we're doing what we're doing so that you're comfortable with it. But at the end of the day, like I said, I do feel empathy for both parties. Like it will forever change that person's career. And then it will obviously change that patient's life. Also,
Yeah.
like it's a fucking lose-lose situation in both ends.
Yeah.
And I know that there's a lot of focus on the patient, and of course there should be because it's a public safety thing. But there's never any talk about like, fuck, I know that doctor feels terrible, and
Right.
I know that doctor probably will never work again. Like imagine somebody taking away your complete profession, your identity,
Yeah,
everything.
everything. Yeah. So it's bad on both ends. When I hear people in the clinic be like, oh, I don't, want this or that, like it scares me. It it often makes me think about just like how I feel like it's human nature. We're drawn to like sensational situations, right? It's like I don't want to swim in the ocean because I might get bit by a shark, or I don't want to fly on a plane because planes can crash. It's always the like 1 in a million risk that they focus on and that they try to like remove from like the risk in their life, but yet they take medications that have like a 1 in 10 adverse reaction rate. They hop in their car every morning and drive through rush hour traffic where like your chance of a serious car accident, so
You're right. Just like watch any drug commercial on fucking TV.
my wife and I laugh all the time. We're like, okay, here we go. Is it going to be explosive diarrhea? Or is it going to be like,
They always leave with a diarrhea shit, but it's like it's just diarrhea. There might be a risk of fucking death. You might fucking kill yourself.
serious infection?
Yeah, you might go on a psychotic break. It's just like, yeah, I promise you, the medication that your medical doctor is prescribing you has a longer list of adverse effects than a neck adjustment.
Absolutely.
Yeah. One other, just like, I know this is a tangent, and we're gonna do like kind of like another episode called "The Journey of Your Low Back Pain," meaning
Yeah.
like what generally happens if you go down an allopathic, meaning like you go to a medical doctor, what happens, what are the stages, and like what generally happens, and then you'll eventually find me, and then I will have to
I feel like
reverse
sometimes
all
people
this.
think we're like Nostradamus because we're like, and then I bet you did this, and then I bet he said this.
But okay, what is one of the biggest epidemics in the Northeast right now? People are hooked on painkillers, right?
Yeah.
And how do they get hooked on painkillers? Because they generally have some fucking crazy back pain or neck pain that they can't get rid of.
So you got prescribed like an opioid.
Right. They get prescribed an opioid so that they can like live their lives. And then what happens?
Will you build a
They
tolerance?
build a tolerance, and then they got to go higher and higher and higher and higher. Okay. But do you think that the medical doctor is telling you, oh, you also might be on Harry Hines
Turning tricks for heroin.
turning trips because I can't give you any more opioids, so that you have to fucking find drugs and blah blah blah, right? Like, guess what the adverse effect of like me doing a back adjustment on you to alleviate some of your pain is? One, you're never gonna die from a back adjustment.
No. Yeah.
Two, you
When
might
I will
just feel
sore.
comfortable. You might be sore or bruised. Like,
Yeah.
in our consent forms for back adjustment, like the risk of back adjustment is like you're basically going to be bruised if that's the worst thing that could happen, or you're going to be worse, a little bit worse off. But then I'll have like other things that we
Right.
can do.
Get you out of that.
So I again, like back to your point, which is like other things have way worse adverse effects
Right.
than anything that I will ever do. And I think like your risk assessment needs to be readjusted because like there are way
Right.
worse things in life.
And it's easy to like laugh at people. My mom will send me an article. And in the past, when I was younger, I would be more quick to like kind of judge the person. But the more that I experience the way our kind of like, fear-based news has kind of put us into this situation where when all you hear on the news are like the craziest bad things that can happen to you, I think it's natural that you create like a culture or a society where people walk around afraid of stuff because that's all they see. And it's hard for their mind to then place that risk in like the greater scheme of things and realize this is not going to happen to me, because a lot of the things that you'll see on the news, they're very specific to a certain location, uh, or like a socioeconomic status. Like for instance, like when this is top of mind for me because we just had another baby, and you hear things like SIDS.
Yeah, SIDS.
Those things don't happen in houses where the baby has its own room.
Yeah.
There's no one in the house that smokes. Like,
Yeah, there are risk factors.
there's all these risk factors.
There are a lot of variables to it.
And so you have these parents that are like super nervous about X, Y, and Z, but the doctor didn't say like, they didn't ask them like, hey, do you have this, 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 or this? Then you don't need to worry.
Yeah, I mean it's important to talk about like everything is in context.
Right.
Right? Nothing is ever black and white, and you have to make good judgment calls. And you're having to make good judgment calls all the time. But like I told you, and we've talked a lot before, which is um look, there are a lot of red flags before you walk into a doctor's office that you're like, oh, I shouldn't probably be here in the first place. Again, to each their own. They're gonna
Right.
do it's your healthcare. You can do whatever you want to do with your healthcare. But if you don't want to have an adverse effect, those things that I talked about earlier, those are your red flags, which are telling you like, yeah, like this is not. The other thing that I would tell you is a red flag. Just one other thing is like if they're trying to sell you on a treatment plan, right? Like
Right.
they're like, we need to see you
20
like
pack.
50 pack, and we need to see you 3 times a week. And again, the other things that I talked about, like, which is like they didn't touch you, they didn't ask your history, blah blah blah. Those usually precede that before, and then it's a immediate sales pitch. Like when you're getting sold something.
Absolutely. And then I think the last thing, not to go down like the conspiracy theory route, but not only do you have to look at the type of news that you're getting,
Yeah.
but you have to put it, and we're talking about context, you have to put it in the context of like who benefits from negative
Yes.
press about something.
Yeah. Look,
There's bias there.
I think that what people don't understand is there's a long history between the AMA and their lobbying versus every other profession that was trying to get into medicine, right? Like AMA has a strong bias to keep a monopoly on healthcare in America, or
American Medical Association.
American Medical Association. The AMA, not ask me anything. they have a strong bias. And then in the early years, they were 100% trying to discredit chiropractors. They were 100% didn't want dentists to even be a profession, right? So they were really, they wanted to have everything. And I get it, to have a very strong profession that, that's naturally what they would want to do.
Yeah,
They
you wanna
wanted to have a
protect it.
monopoly of the whole thing. And so even as there's been one case where 4 chiropractors were able to successfully sue the AMA, in the sense of like the AMA was trying to discredit chiropractic for many, many years in the 70s, 60s, 70s, and 80s, and then it stopped because they won a suit versus the Supreme Court. So it's a real thing. And I'm not saying that our profession, my profession, doesn't do itself any favors.
Yeah.
There's just some kooky, and it's hard to, in America, it's really hard to, if you don't have the money or the resources to find alternative care, good alternative care.
Right.
And you're kind of seeing like a renaissance of this. Like people are getting way smarter of like, why am I doing it this way? There are better ways to do things.
Yeah.
And so people are more informed. But just like you just said, like even there's a lot of misinformation out there too.
Right. Yeah.
And look, it's again, my profession does not do itself any favors. I mean, we as as a company, which you have seen, when we interview doctors, our third interview is like an in-person interview where I'm testing their clinical skills.
Right.
You know how many times a doctor has come in, done that clinical skill portion of the interview, and they're like, I've never had to do this ever.
It's a lot. Like
It's
all of them.
all of them.
Yeah, all of them. Yeah,
It's
which is
all
like shocking, but
Yeah.
like they haven't been put in that pressure cooker situation.
It's not even that. Like, I don't know what's going on with other clinics, but why would you ever trust a doctor just coming off the street? I need to see what your clinical judgment is like, right? Like,
Yeah. And then we do like a sort of like a secret shopper where it's like, hey, we have a couple
of patients
that come in and we trust their feedback. So we say, hey, we're gonna need you. We want this new guy to work on
Yeah.
you. Let us know what you think.
Yeah. And I mean, I already know what's going on with those patients. And also I know I'm watching those patients. So like I would never let it get to a place where
It's dangerous.
it's
Like,
dangerous. But yeah, like I just think it's like insane. So it's where our profession doesn't do us any favors either. And again, I don't get mad at the perceptions that happen to chiropractors, because it's honestly, there's a reason. Like there's a reason
so
for
just
stereotypes.
brought on themselves.
Yeah, and it's brought on ourselves. So I get it. And also there's like, it's still, again, I think that I am one of the very few doctors that can easily talk to an orthopedic surgeon and be like, these are the reasons why I believe. And honestly, if I'm sending you to an orthopedic surgeon, it's because you fucking need to go to an orthopedic surgeon. I've done everything that I possibly can.
We're looking at an MRI recently.
Yeah.
It's like, you are missing half your labrum.
Yeah, which is like, that's a great example, right? This patient has come down from essentially Waco to come and see me. His shoulder, he can't move it. I was like, you have something fucking gravely wrong with your shoulder.
You can't lift it.
Yeah, let's get an MRI. I do my orthopedic test. I'm like, I know that this is something that is probably surgical. The doctor that he sees in Waco is like, no, your shoulder's totally fine. And I'm like, what?
What?
I'm reading this MRI. I'm like, your shoulder is hanging on by a thread. I have to call him and be like, no, you need a surgical consult. You have half of a labrum and you have 3 tears in your rotator cuff. I don't really see how this doctor missed that. Like, did they even look at this MRI?
Or did they even ask him like what sports do you play? Like what type of like quality of life do you want going forward?
Yeah. And so then I was like, look, you need to see this doctor, this doctor, this doctor. And those doctors that I'm sending you to, I have relationships with them, and they know that I'm not just sending them, like I'm not giving them a fuck
They
off.
don't get a call unless it's something.
It's something real. And I'm like, these are the things that I saw.
Yeah.
You know what I mean? And like, I would highly recommend that you look at this as
I've
a surgical
never
consult.
I've never seen such a drastic disconnect between like what someone was told based on their like the radiologist
Yeah.
and like what the actual MRI, well, first off, what it looked like when we looked at the
Yes.
imaging, and then they, the radio, like there's a whole what's
Yeah.
the term, the findings or
The
whatever.
findings. I mean, you saw it in real time because like this patient is telling me like my doctor said everything was fine. So I'm going into this like
Yes.
looking, and then you're seeing me like
You're scrolling.
You're like, wait a minute,
That looks bad.
this is for sure a tear. Like I'm like, I know what a tear looks like.
Right.
That is for sure a tear. And also I would preface this by saying like, honestly, I might be the 1% of chiropractors that can read an MRI because I do it so much in my day. And I also have gone to conferences and I make sure that I'm like constantly looking at
Yeah, learning.
imaging
Yeah.
and learning. Not everybody, I would not just normally give that. I would never give my MRI to a normal chiropractor. They would not know what the fuck they're
Yeah.
looking at. But I would tell you, always get a second and third opinion,
Right.
especially because, again, going back to the risk profile, some people just take it for granted that the doctor, I think every doctor has the best intention, but they also have other motives too. And they're like, yeah, we just need to do surgery. I'm like, oh, before we even do that, can we get a second or a third opinion? Like yes, there's a little bit more time, maybe a little bit more money. Guess what? You can only cut into you one time.
Yeah.
We only got one fucking shot to make this fucking work.
Yeah.
Why on earth? My only example of this is I have a golf coach out there that had a wrist surgery, and I was begging him
Nice.
to get a
A second
or third opinion. I also sent him a fucking long list of questions to ask his, and guess what? He didn't
Just
do
did
any of it.
surgery.
He just did the surgery. Guess who is still having fucking wrist issues now?
Right.
It's, like, it's so frustrating. And
It's really frustrating.
I gave him all that shit for free. Like I didn't even charge him for a fucking appointment. I just was like, please, just please ask these questions. Because I also know the statistics around that type of surgery, and it's usually not a good outcome. But he was being fed that it's going to be fine, like it's going to be fixed, and you'll be back to playing golf. I'm like, no, this is a very hard surgery.
Right.
It's not, and the success rate is not good.
Yeah. You're your own yeah.
I'm just gonna step off my soapbox now.
Yeah. It just, you have to advocate for yourself. You have to, it's a tough situation because you have to know the right questions to ask. And if you're going into, an orthopedic consult and you don't have anyone in your life that that knows what to ask that doctor, you can get yourself in a situation where,
and this is why you need multiple people in your team, right? And that's part of the reason. Like people who have relationships with me and have been seeing me forever, like they usually consult me beforehand,
Right.
and I already know that they're already seeing it. I'm like, these are the questions I would like you to ask, so that you are comfortable, and also just for my knowing of like what is the success, and then we can consult each other and make the decision together and be like, yeah, I really think this is what it is.
And it just goes to show, it reinforces the fact like, we do a great job to the point that people really trust our opinion.
Yeah.
They really trust I mean, when we were on the phone with that one patient, he literally goes, what is your recommendation? Like, what do you think I should do?
Yeah.
And it's tough because you're giving someone bad news.
Yeah.
Which is tough because this athlete is obviously very active, wants to continue doing very ballistic, explosive movements. And it's like, if you want to enjoy the rest of your life and doing this, like, you're probably going to need a serious surgery. So you need to reach out to these doctors.
Honestly, and again, I'm not an orthopedic surgeon, and I don't pretend to be one on TV
or on podcasts
or on a podcast, but it's I mean, his shoulder was really bad, and I was like, I would probably ask about full shoulder replacement, versus like what it looks like to repair it.
Or at least ask what both of those
Yeah,
roads look like.
yeah, and so it's a tough conversation to have, but it's something that, again, you're not going to find this in a normal doctor
Mhm.
or a normal chiropractor. I was immediately like, this is an immediate referral to an ortho.
Yeah.
Like, you need to see an ortho. And we have a type of practice where we have to have good relationships with orthos because I'm constantly sending them to orthopedic surgeons. Like, I do get a lot of cases where I'm like, ooh, this is not a good joint,
Right.
and I can't fix this.
And that's what I think another reason why chiropractic sometimes or chiropractors sometimes get a bad rap is you get in the situation where you hope that the chiropractor is unaware. I guess both have their own issues. Is either they were unaware that this is something that they can't fix,
Yeah.
which means they don't know what they're doing. But I think it's even worse if they are aware that it's a surgical intervention and they just continue to treat the person, because what I've noticed in the clinic is you're really good at, if I can't figure out and fix this within like a couple visits,
Yeah.
and you're kind of like, this is weird. Like, this should be feeling better. By the third visit, you're like, you need to get some imaging.
Yeah.
There's obviously something else going on in here. If it's not responding to this type of treatment, then it might be surgical.
Yeah, and then being able to read the imaging and then
Right.
being able to talk to another ortho and being like, this is what I think this is.
But like, if you could continue to see that person for who knows how long. And that's just like you're not,
No.
it's all about helping the person.
And also I'm busy. Like, I have like a million fucking other athletes, so I have to get it.
We'll help them out to the surgery.
Yeah. Well, also, it's really important to make the distinction of what, a lot of doctors will put up a shingle and then be like, I'm a sports doctor. And you're like, no, you're
Right.
not.
It takes years and years and years.
It takes years and years and years. It takes a lot of education. And another warning sign is like, if they're like sports injury plus auto accident,
Those don't mix.
this does not mix. It's
You're
like, I promise you're an auto injury. You're an ambulance chaser. So, yeah, there's just very few people out there like me. There just is almost and anybody that is like me has probably worked for me at some point in time and like learned how to do it correctly.
Yeah.
Because I don't know anybody in Dallas that does it the way that we do it.
No.
And the way that how thorough we are. So that being said, like, we just really wanted to like demystify
Right.
what a neck adjustment was and maybe some of the warning signs and just to like cap this, because this the cap should be really now I'm just speaking to the doctors out there, and it can be oftentimes missed easily, but the symptoms that patients will come in with are a severe headache behind their head, really, and oftentimes they will, in their history, they will say that it is the worst headache that they've ever had. Like, it's 11 out of 10. It's debilitating. They have neck pain. They have nystagmus. They have loss of muscle tone. They are yeah, there you go. No, you gotta push. Yeah, there you go.
Well, I was getting nervous that I'd been on mute for a while, but I could hear myself, so I was just getting really scared that I've been muted for like who knows how long. We'll find out.
You can be. Well, you weren't muted. Muted again. You had to actually push it. There you go, and it starts to blink.
Okay, I wasn't muted.
Yeah, you weren't muted. Okay, so let me restart that before I was. You're gonna have to edit that out. Okay, so this last part really is just for the doctors out there, because ultimately, like, I don't want an athlete or a patient to be mishandled and have an adverse effect. And also, I don't want the doctor to ever have to go through this. So let's go over quickly what are the what are the major signs of a person that's coming in. One, the mechanism of injury doesn't make any sense. Two, they have the worst headache that they've ever had. Like they will say it's like right behind their head. It's really bad. They'll have really bad neck pain. They'll have nystagmus. They'll have maybe loss of muscle tone in their face. They'll maybe have issues into their
Dizziness or
hands or their limbs. It's the combination of all of those things that you can be like, and also it's really important to be, it's better to be conservative than it is to be bad. So like, guess what? Unfortunately, if you just do soft tissue work into the neck, and again, not all doctors have this skill set, but usually that can make them feel better. Like oftentimes if that happens, and I'm like still unsure, I'm not adjusting their neck.
No.
I'm like, I'm doing acupuncture maybe, and I'm also like, look, let's like look at this for the next 12 hours if it's or 8 hours. If it's still that bad, and go to the emergency room.
Right.
There's nothing wrong with saying let's go to the emergency room if this soft tissue doesn't work or if this acupuncture doesn't. Those are such low risk profiles.
Correct.
But know the signs and symptoms first.
Yeah. Which all goes under the umbrella of like, you need to be well read on anything you're going to be doing. Like as a patient, whether you're going to a doctor, chiropractor, physical therapist, like it's important that we do our own research. And
Yes.
I know that I did my own research, and then it's like the mom on the toilet, like on her phone. But like, I know that's a joke, but it's better to do that than nothing.
Yes.
And so if the more you are, and the more you've consulted other people and other, experts, the more information you have going into whatever treatment you're looking into, the more likely you are to get what you're looking for, and to be, more safe as
Yeah.
well.
Yeah, it's again, you be educated as a patient, advocate for yourself and ask the questions. And honestly, um the doctor should never get defensive. They should just answer like they're just doing the athlete or the patient is just making sure that this is the right thing for them.
Right.
And I never get mad when a patient asks me or they like you see this, there's like at least 4 or 5 patients that don't want their neck adjusted. It's fine.
It's fine.
I just explain it to them like this is going to take way longer. Or there's people that don't want to get needled. It's fine.
It's just going to take longer.
It's just going to take longer. And if you're okay with that, then I'm okay with that. And,
Right.
right? Like my priority and my wants is to like get you better as quickly as possible, but that's not necessarily always.
And then sometimes we see the opposite. People come in and they're like, "Why didn't you adjust me? Like,
Yeah.
I want. Can you adjust my neck?"
Yeah.
And
Or why didn't you needle me? Or why didn't you
they
stim on
want
it?
those things, and you're like, "Well, that's
Well,
not actually what."
the whole point is to get you off of this shit.
Right.
So the whole point is to get you to Eric, and then Eric fixes you for good, and then you never have to come and see us
Right.
ever again.
Right.
We're just not that type of clinic. I mean, look, we have some maintenance patients, which we love, and
Yeah.
they are the smart ones because I'm catching things way.
They're using it as a preventative now,
Yeah,
where they're just keeping their body tuned up,
yeah,
and you only get one body.
yeah. You
So
only
you
get
take
them
care
now.
of
You
it.
better take care of it. So yes, this was our. Hopefully, this quells some fears out there.
Yeah.
If you guys have any more questions, please like comment on the podcast, comment on YouTube. We'll obviously put a bunch of clips out here.
Mhm. Like and subscribe.
Yeah, like and subscribe. Yeah, if you like this episode, please like and subscribe and follow our podcast. And if you have any more questions about like sports medicine or strength and conditioning, just
You can reach out to us.
comment to us and we'll get it on the podcast.
Yeah.
All right. Well, we are SPCAST, humans helping humans, and have a great day.
Yeah. See you next time.